Welcome and thank you for joining us for today's webinar on leveraging technology to create an effective and compliant practice. In the spirit of reconciliation, Practice Hub acknowledges the traditional custodians of country throughout Australia and the connections to land, sea, and community. We pay our respect to the elders past and present and extend that respect to all Aboriginal and Torres Strait Islander peoples today. Thank you for joining us for the latest webinar in our Foundations for Successful Practice Management series. We have had yet another overwhelming response to this webinar, so clearly it's a topic of much interest, and we have a great panel with us this afternoon who will be addressing some of the many questions which have come through during registration, which we thank you for. On our panel this afternoon, we have Gary Smith, known as the Guru of Practice Management. Gary Smith is an academic director of UNEP Health Programs and an experienced health practice manager, as well as a former National and New South Wales president of the AAPM. Joining Gary, we have Joe Mahendran, CEO of Ultrasound Care, who aligns the strategic direction of the organization, optimizing processes to ensure a highly professional and trusted services for patients, referrers, and other key stakeholders. And Anna Maria Gibb, the co-creator of My Practice Manual, now Practice Hub. Anna Maria has a background in practice management and qualifications in business and adult education. I will now hand over to you, Anna Maria.
Fantastic. Thanks, Katrina. So welcome everyone. And again, thank you for your time. In today's webinar, we're going to have a look at the healthcare innovation landscape. And as I'm sure we all know, the speed of innovation is quite frantic. We'll look at the benefits and challenges of implementing new technologies, and we'll talk about some practical tips on implementing new technologies. So on that note, Gary, can I hand over to you, please?
Thanks very much, Anna Maria, and welcome to you all. In our presentation today, leveraging technology to create an effective and compliant practice. I want to start off with a quote by Masha Detuit from The Broken Path. Knowledge is a dangerous thing, but ignorance is no protection. And how true that particular statement is. We in healthcare, especially in management, around technology, really can't bury our heads in the sand on this. Because as a practice or as a business, a small to medium enterprise, that's we're running, an SME, we need to respond to external influences or external needs. For example, we respond to maybe patients' needs. We need to respond to government requirements. We need to respond to society expectations. For example, there's the usage of SMS now. It becomes standard for us to receive SMSs for our appointments for our animals at our vets or for our hairs to be cut or whatever it may be. So why isn't healthcare involved and taken up the technology around simple things about society expectations of the use of SMS? A great debate to have around the water cooler in your practice is, are our patients or our stakeholders' expectations our obligations? It is a good discussion to have. And I'd like you to have that discussion around setting the expectations of your practice when we come to the obligations or the expectations set by your patients. Change for change's sake is not good, but change for survival is critical. No change means that you and I are going to be left behind. So we need to start to think about this change process around information technology and what does it mean to the ongoing success of our small to medium enterprise, our practice. I'll give you an example. There is a blanket company called Onkaparinga, and some of you will be aware of the Onkaparinga blanket. I think they provided blankets to trench warfare in the First World War. Excellent. Maybe your grandparents may have an Onkaparinga blanket in the cupboard now. But when the doona came out, Onkaparinga said, it'll never work because we have the best blankets in the world. But they struggled because the doona became what society expectations were. And it was the same with Henry Ford. He built the American dream car, but expectations of the Americans changed. They wanted to pump up tires and windscreen wipers and leather and timber. And he kept saying, no, they want my car. He went bankrupt. So when we start to think about this whole aspect of change, we are being moved forward in relation to information technology or technology as a result of what society expectations may be. Healthcare is an industry, I think, in need of innovation. Health plans, providers of health services, and government are really facing rising costs and inconsistent outcomes as a result of the delivery of health. We are now working to improve healthcare and health outcomes of all our patients, all while hopefully reducing costs and spending. Now, what innovations are most likely to help stakeholders, which includes our patients, achieve these goals and transform healthcare over the next 10 years? On this slide here, the first 5, look at number 5, leveraging social media to improve patient experiences. Now, this is just not about, utilizing a Facebook. This is also, or TikTok or those Instagram or those other components. Where does real-time experience actually fit into leveraging social media to improve patient experience? There are people now, digital expertise, that are actually tracking real-time data from all sources of social media, and they're now utilizing that in real time in relation to their performance. Radio stations are now doing this now. They're not going to wait for a 13-week feedback on ratings. They're now doing it in real time. So the challenge you and I have got is start to think about as innovations, how do we start to capture this intelligence around into making better outcomes and decisions by our patients? Now, incorporating in these 10 top innovations into business models will require changing how you and I currently prevent, diagnose, monitor, and I think treat disease. Now, leaders, which you and I are in our professions, should determine which of these 10 innovations I put up here break performance trade-offs or create more for less in a way that impacts our core business. Now, we should consider building ecosystems or things around us that embrace what I call non-traditional layers and sources of knowledge outside our own 4 walls. But then we should consider how building pilots before investing in scale. We need to learn to embrace change and evaluate new revenue sources. And we should also strive to be agile in anticipating and adjusting our strategies as innovations continue to evolve. The question I've got to you in relation to these healthcare innovations, are we proactive or are we reactive? And I suppose a practice needs to be proactive in their thinking, and we can only be proactive as a result of information which we may have. We have so much data in our systems, whether it sits in that black box on the floor or whether it's by social media, whether it's by surveys, we have so much data. How do we utilize that data? Start to think about the future, thinking for the future. Don't put our reading glasses on or our rear vision on and say, what's happened in the past? Let's think about what we may need to do in the future. Take into consideration what may be the expectations being set by society overall. I've identified some steps here for planning, implementation, and evaluating of a digital solution. Now, the first step is actually to understand digitization in the healthcare context, because there's lots of digitization, but just think about in yours and my context. Not every business is digitally innovative. It would largely depend upon the size and type of your practice or your business. It will also depend on the preferences of the business owners and their aptitude to embrace technology. And I think that's one of the first things. Where does technology fit in relation to the understanding within our business and what we want to do with it? The second point is know your business. You'll need to understand that the practices, procedures of your business. You'll need to understand your patients or your customers, their current and future needs. This is the future benefit analysis we need to start to think about. What are their needs for the future? And I'm going to talk a little bit more later on around technology and the implementation of the 10-year health plan for primary healthcare and what does that mean around voluntary patient enrolment. We need to start to think about the future needs accordingly. The third step is investigation of digital solutions. And I think there's an environmental scan that we need to do. We need to identify that a digital solution may be a possibility. So you'll need to investigate what is available in the marketplace and how it can assist you. Because not every digital solution in your practice, in the marketplace, will suit your style of business. Point 4 really is doing a cost-benefit analysis. You need to think about and do your research into what are the digital possibilities, and your analysis of your own business practice. You'll need a ballpark figure of the cost of potential digital solutions and the operational cost involved in using the current system, and also identifying what the costs of moving forward. I think one of the areas where we do cost benefit analysis may be around implementation of a new appointment system, or we're starting to think about moving our data to the cloud rather than the server on site. 5 is I think, is consider impacts. And I know we're going to talk a little bit more about this later on, but you should also investigate then preparing estimated figures regarding the financial component of this. What are the impacts, the risks, and the challenges of implementing of these new digital solutions into your organisation? But take into consideration what may be the human impact in this as well, based around the change management process. And number 6, I think, is consult experts. I think you'll need to find consultants that you can trust within the space that you are working in. Because if we don't do that effectively, you'll find that the costs will be quite extensive for you. The next one, we consult experts. We need to consult stakeholders. And if you're considering a potential type of digital solution, you'll need to consult with others within the business to get a proper perspective on how the work of others may impact, and for the detail of how the business practices and processes will be likely affected on a daily basis. So when I talk about stakeholders, we talk about internal and external stakeholders. We need to have the discussion in relation to workflow in regards to the internal stakeholders. Point 8 in implementing and planning digital solutions is really trialing options. You'll need to understand how digital solutions may work in your particular business environment, because not every digital solution will slot into like a glove into your particular organisation. They all vary because you all have different reasons for an operation to make it work. Number 10, I think, implement digital solutions. That's the next part of this. Implementation of the system in the business is not a simple matter of installing some software and pressing a button to act for these two to activate. There are greater things at play, and I think Joe later on will talk a little bit more about implementation solutions and what that may mean. After implementation, the big thing for me is monitor digital solutions. Number 11, monitor the solutions and change in the process. It's unlikely you'll have a perfect solution working without a hitch, with everyone on board and happy from day 1 or day 2 of implementation. We need to monitor what is the effect as a result of workflow and people's adaptation to the system. And number 12 is really to evaluate the digital solutions. Once a new system has been fully implemented and in place for a while, it is really good to sit back and evaluate the system to say, is there a better way of looking at this? And also in relation to the time and the money which we put into it. So there are my 12 steps for planning, implementing, and evaluating a digital solution. I'm now going to ask Anna Maria if she can launch the poll and talk to the questions that we are identifying.
What do you think are the benefits of increasing the use of technology in your practice? So saving time on administrative tasks, saving time on patient management, reducing risk to the practice, and meeting patient expectations.
Thanks, Anna Maria.
Yeah. So Gary, just on that, I guess one of the things that struck me when you were just talking, I think a key question when you're thinking about this is, what does success look like? What does a successful implementation look like to you and the whole organisation?
Yes, it's a very good question, because success will come in a number of ways. Success for the person at the front desk is different to the success for the person who's put the money up and invested. Also different to the person who's provided the digital solution for you. So once again, it's what you see from where you sit, Anna Maria. Two people looking through a prism, one sees sky, one sees dirt. So what we need to do on the implementation and management of it, success means different things to different people. And that's one of the reasons why the consultation process is so important, to air the views in the first instance, to manage those risks which may pop up. So I think management of risks is a big part of what does success look like. So in any solution, success will vary depending upon, it may be from a clinician may say, oh, there's too many strokes, I've got to click too many clicks now. Is that success? To a clinician, the answer is no. So we need to identify what each means to every single one in the process. And we need to get those on the table right up front.
So our most popular was saving time on administrative tasks, up there with 87%. Now people could vote on more than one, but that was the most popular. And then equal, second was saving time on patient management and also meeting patient expectations. So I think that's probably pretty indicative, I think, of what we know about the reasons people look to implement technology. increasingly in their practices.
It's interesting, Anna Maria, if we sit and think about where we've come from to where we are today. And I actually think we've got to reflect at times when someone says to me, oh, look, it's taking so long to do A, B, C, or D. And I say, go back and think about the day when the doctor had to physically write the script out, or you as a receptionist had to physically write the receipt out in the Xeon's receipt system compared to where it is today. So let's reflect. So how far have we come? So let's not lose focus of how far we have come. So when we look at those polls, when we think about the administration, that actually links into the other three in the ability to provide health outcomes to our patient. So efficiencies of administration systems flow all the way through to delivery of good healthcare. So when we look at the benefits of digital health innovation, and I've given there's 5 here on this slide, benefits for digital health for patients. What does it mean for them? Well, some of you have already identified it. It does mean improved timely access to health services. Just think about online appointment systems, or think about the telephone systems you use. Access to health information, yes. I know in my practice, we have fact sheets on my website for our patients. Also, customers are more actively involved in their own healthcare. I think digital innovation has allowed that to happen. And of course, the big one for us all is health providers can drive targeted preventions, early diagnosis and appropriate interventions. Just think about coding for diseases in our software, for instance. Who would have thought? If I wish to now just look at my patients who've got diabetes, I just type in a code and they come up on the screen. If I've got diabetes and I go in to see my doctor, they just put in the code and my diabetic consultations come up. So yes, it allows us to continue to provide good health care to our patients. But Joe, what do you see as the most critical point of implementing any digital solution in your practice?
Thanks, Gary. Well, a couple of years ago in my practice, when patients used to come in for their scans, they would take images away that had been printed on a piece of paper or maybe loaded onto a USB. And a couple of years ago, we changed that process so that patients, they were wanting this. They wanted to be able to share their images more easily amongst friends and family. So we were able to start giving them images via a link via their mobile phones. So that was a digital solution that we implemented. The most important part of that, I think, was making sure that all the staff who had to interact with that solution had the right training so that they had confidence that they could make that solution work. And also by giving them the right training, it also meant that the patient experience was great because any hiccups could be dealt with by our well-trained staff. So I'd say training is a critical part of the implementation process.
Yes, I have to tend to agree with you on that. It's the forward preparation, isn't it? The challenge with us all, because we're so busy, we say to ourselves, have I got the time to invest the time up front? And generally we don't have, but there is so much further saving at the end of the journey, isn't there, Joe? By if we invest the time up front.
Absolutely.
Well, we spoke about the benefits for patients in relation to digital health. So what's the benefits to you and me and the staff who work within our services? I think access to real-time data, and I think that's very important, access to real-time data so we can then make good informed decisions in relation to patients' health outcomes or any other outcome we wish to achieve. There's automated processes. I think the big thing for us in the future is predictive analysis. I think we need to start to think about that. Supported decision-making tools. And I just want to talk about supported decision-making tool. This is a very simple one. And this is a result of a question which came in. This is around utilising Microsoft Outlook, for instance. And I'm a big Outlook user. I live by it. I live by my calendar. I live by my tasks. I live by my emails, even down to the extent that all my appointments are colour-coded, Anna Maria. All my email addresses for certain emails are colour-coded. So when I see a green email come through with a green mark, I know that's an important for me. That's about a board information from some of the boards that I sit on. If I've got to do accreditation, they come in pink. So rather than actually having to read the information or the email, I can do it by colours. So that's a really good process that I just find it saves so much time. And that's just one example of digital health innovation that suits me. I want to quickly talk on delivery of quality person-centred care. And I think this is really important. We need to start to think about innovation here because of I'll just give you the example, the 10-year health plan for primary healthcare, which is going to start to be rolled out in July 22. And this is around voluntary patient registration. And VPR is taking place in July 2022, where if a patient is voluntarily enrolled at your practice, they will be able to gain access initially to telehealth. Not voluntarily enrolled, no telehealth. So we're going to have to start to think about, what does it look like in the future? What does technology look like for us in the future as around person-centered care? Now, for non-clinical staff, and I just touched on that just a moment ago in relation to Outlook, there are definitely benefits to the non-clinical care, like you and I as well. I think there is definitely improved efficiencies in operational process, which you had indicated that 38% indicated that in the poll just a moment ago. As I said, could you imagine writing those receipts manually? Could you imagine trying to do profit and losses in the big ledger books? Some of us remember the big ledger books which we opened up. Do we want to go back there? No, we don't. But what does tomorrow bring for us? We need to start to think about, what does tomorrow look like? We may not like it, but there are going to be some definite benefits for us in relation to improved accuracy. So in most cases, digital innovation has come about because of investment to meet a specific business need, or we were identified an opportunity. So digital innovation can also be a government concern, as evidenced by the Australian National Digital Health Strategy. And I think we need to think what the National Digital Health Strategy looks like. So there are benefits of innovations in digital health. They're vast, not only for your patients and clinicians, but also for you as non-clinical and the wider community as a whole. The challenge that you and I have got is that one size doesn't fit all. The size, the structure, the complexities, and the needs of your business will determine what sort of digital solution. And while Anna Maria's launching this particular poll, I learned a long time ago that if I could get a digital solution that will cover off 90% of what I'm looking for, buy it. Because I'll never find a digital solution that will do 100% of everything that I need. So start to think about, a plan is not a plan until it's implemented. So think about that whole process of planning based around, what do I think I need for the future, but also think about, I will not get something that'll be 100%. Poll number 2, Anna Maria.
Yes, so thanks, Gary. So basically this one asks, do you see technology as mostly a cost, mostly a driver of efficiency, or a combination of both? Gary, your comments about doing it manually reminded me of the first practice I worked in, where we had the Kalamazoo register. And we used to do that. And then, of course, we had the carbon copy Medicare slips that you pop through like the old credit card machine, you know, the zip-zap machine. So I don't think anyone misses those days. And I suspect a lot of younger people, you know, I've got teenage children, they would think that's just hysterical, that that's how we used to do things. You know, my phone has more power than my first home computer had. So, you know, you do look back and think, can you imagine how we used to do these things?
The challenge, while we're waiting for the results, Anna Maria, the challenge for us all is that if we think there has been large technological change in the last 5 years, I want you to challenge for what's going to be the future. Because I think in the next 3 years, interaction with government is going to increase. All government departments, whether it's state or federal, is going to increase. So we need to start to think about that. Look at this. It's interesting. No one is meant, do you view technology as mostly a cost to the business? It's interesting, 0.
Yes.
Mostly driver efficiently and a combination of both. So when we're thinking about some of the challenges, and I just identified only 4 of them here for your future reference, can be constraints around budgets, around complexity and costs of delivering care. It could be around patient expectations, and it could be around availability in relation to things like hospital beds. So Joe, what was your biggest challenge in the introduction of a new technology solution into your particular service?
One of the key challenges that we face is that practice software that we use is integral to everything that we do, as is our existing IT infrastructure. And so whatever technology solutions we bring in, they have to integrate well with that existing infrastructure. And if they don't integrate well, often we can't adopt those technology solutions. So the way that we address that challenge, because it is a challenge for us, is that we try and make sure that we have key contacts from our practice software vendor and also from our third-party IT consultants, so that they're there at early stages of technology projects, so they can advise us as to the integration possibilities. And that way, we make sure that we don't go too far ahead with a technology solution that won't work for us and that's going to end up being very costly.
Joe, thanks very much for that. That reminds me, we've been, in my practice, we've had clinical and practice management software now for about 20 years, and I've never had a software that's not fully integrated. And I think integration, it just minimises the risks that we may have accordingly. So integration, I agree with you, is one of the biggest challenges. Anna Maria, what would you consider be some of the support you think that PMs may need when introducing new technology into their services?
Yeah, I think they obviously need good training for themselves and their staff. I think where there's a lack of confidence in the technology, that kind of has a detrimental impact. I think also nowadays, the ability to easily access information on how to use products, to have key contact people who understand your business type as well. I think that's really important.
Thanks, Anna Maria. I'm going to hand over to Joe now. And Joe's going to hopefully provide you some practical approaches to leveraging technology in your practice. Over to you, Joe.
Great, thank you, Gary. So as leaders in our organisations, I think one of our roles is to maximise efficiencies. And as Gary has outlined, new technology solutions are a way that we can achieve this. But with so many technology solutions available, and at a practice level, often with limited resources, how do we decide which technology solutions we're going to implement? And I think a really useful starting point is to review our existing processes and ask ourselves lots of questions. So in my organisation at the moment, we're implementing a new technology solution that's going to significantly change the way that we produce reports, which then go on to patients and their referring doctors. And this is a critical part of the work that we do. So this project will have a significant impact on our workflows and on our business. And the project started as a result of asking ourselves some of these questions. So I won't go into too many details about the process, but at the moment, when a patient comes into our practice, they're registered and a paper worksheet is printed off. And that paper worksheet then follows them into the scan room where the sonographer scans them and manually fills out that worksheet with a pen. The manual worksheet is then handed back to the secretary, and the secretary manually scans the worksheet into the patient file in our practice software. And then the secretary uses the information that's in that worksheet and types it into a report. And then the report goes off to the doctor to be authorized and then released. And so there was obviously a reason why this process was originally set up this way. But because things have developed, we now have the opportunity to relook at it with fresh eyes and look at that key process and see, can we do things in that process a bit better? So one of the first things that we ask ourselves, well, where is the duplication? Do we need the sonographer to be manually filling out a paper worksheet and then the secretary to be retyping all that exact same information into the report? That's some duplication, and maybe we could get rid of that. Then we ask ourselves, where are we wasting resources? And that can be time or money. So one of the questions we're asking ourselves is, do we really need to be printing paper worksheets at the moment? Is that something that we can stop doing? Do we need to be manually scanning these worksheets into our practice software, or is there a better way? Another question that we'd ask is, in our existing process, is there a risk of error? And is that risk unacceptable? Now, at any point in that process where there's manual input, we're only human, so there's going to be the possibility of error. And we have robust check systems in place and a robust quality assurance process to make sure that those errors don't stay in the reports that get distributed. But is there a way that we could automate the process to take out the risk of those errors? Or could we even automate the error checking process? So these were all the sorts of questions that we were having about our internal process. But as well as those, it was also important for us to listen and receive and listen to information that we get from our key stakeholders. And one of the key ways that we do that is by completing complaint logs. And we review these every month. They're a standing agenda item, and we review our complaint logs, not just to check that complaints have been resolved, but to see if there are any recurring themes, because those recurring themes are often going to be a guide to things that we can improve in our processes. We also ask ourselves, is it easy for stakeholders to get their feedback to us? Because the more information we have, the better picture we'll be able to develop. So we've addressed this by having feedback forms on our website, and we've recently redesigned those. So they include a lot of quantitative as well as qualitative information. And that way we can analyze them more easily. We can download them into Excel and analyze them and get information from them. And of course, we also have lots of informal communication, lots of meetings with key staff members, team meetings where issues can be raised and we can get feedback that way. If employees are leaving our organization, we'll have exit interviews with them and try and glean information that way. And if we have people who are maybe seconding with us, maybe they're a work placement student or a medical registrar, we'll have conversations with them too and try and gain the best picture that we can of where change could be beneficial for our organization. So then once we've sort of built up this picture and we've got an idea of the key issues that we have, we then ask ourselves, well, is there a technology solution out there that can help us address these issues? Overwhelmingly, the answer is usually yes, and not just one solution. Usually there's multiple solutions that we could choose from. And like many people, when we're researching technology solutions, we'll do a quick, general research on the internet, and we'll go to forums like this and glean information there. But one of the key things that we've learned through experience is that, as I mentioned earlier, as our practice software, Charisma, is so central to everything that we do, and our IT infrastructure is the same, it's really necessary for us to have early conversations with our account managers at both Kestrel and our third-party IT consulting firm. And the benefit of talking to our account managers early on in the process is that they're dealing with many organizations who are facing the same experiences as us. They're also dealing with a lot of organizations who are working in the same industries as us, and they can guide us towards solutions that they know are going to integrate easily and effectively with the architecture that we already have in place. Benefit of that will mean when we move to implementation, the costs will be much more manageable. We have had situations where we've got quite excited about a solution and then realized it's not going to be easy to integrate, which will lead to a whole new batch of issues. And so we've had to sort of walk away from that potential solution. So getting that advice and getting that information from the people who manage the existing systems that we have has been really critical for us. So I guess we've identified the issues that we're facing, and then we've identified at a high level some technology solutions that may help. But how do we decide which ones we actually want to implement in our business? In an ideal world, we'd love to use or implement all of the solutions, but realistically, we can't do that. I mean, one of the key issues that we have is that we have people resources, constraints on our people resources. We don't have stacks of people sat around waiting to jump in and implement solutions. We're also mindful that we don't want to introduce too much change into our organization and onto our teams all at one go. It's too much, it's too overwhelming. And of course, we also have financial and budget constraints that we have to live with. So we can't introduce everything that we may want to introduce. We have to pick and choose. And then in terms of how we, in my organization, how we choose which projects we're going to implement, we feel it's important to be really clear about how this project, if we implement it, how it will move us forward to meet our overall company goal or aim. So for instance, in my organization, our goal is to deliver excellence in all aspects of obstetric and gynecological ultrasound, diagnostic imaging, and counselling services to women and their referring doctors in Sydney. So any project that we implement has to help us move closer to that objective. So it's really important that when we've come up with a solution that we want to implement, that we can clearly state what the benefits are going to be, and we can clearly show how it's going to move us towards achieving that goal. So for example, in the project that we're currently implementing that I alluded to earlier, the benefits are pretty simple and pretty clear. We'll no longer need to print off paper worksheets for sonographers to fill in. Instead, sonographers will have electronic worksheets that they will complete on their laptops. That will mean that there's less opportunity for error. It also means that the electronic worksheets will be used to populate automatically the reports. So our secretaries aren't going to have to type reports anymore, instead freeing up their time to be able to engage with our patients, who, after all, are the most important reason of why we're there. And so we're taking out some duplication, we're reducing the opportunity for error. The electronic worksheets are going to automatically be fed into our patient software, so we no longer need to use scanning machines and manually scan them in, again, saving time and improving the process. And on top of that, we can build in automatic checks into the system. So it will be virtually impossible for a report that has normal findings to go out with a conclusion that has a significant abnormality or something similar. Those things won't be able to happen because the system will flag them and any of those sort of errors would be eliminated. So I guess to summarize so far, we need to look at what issues we're facing, how technology solutions could help us address them, and then we need to think about determining which solutions we're going to implement. And once we've got to that point, I think the next step is really about, now we've chosen our project, how are we going to successfully implement it into our organization? So one of the things that we like to do in our organization is involve key decision makers very early. So the project that I'm talking about will have big implications on our sonography staff, big implications on our practice managers and secretaries, and it will also have implications for our doctors. So it was really key that we got our medical director and our chief sonographer involved in this project right at the beginning. We wanted to make sure that they were there at the beginning, they could bring their expertise and they could inform how the project developed. We also wanted to make sure that by bringing them on board very early, they would become sponsors for this project. And that will become important later as we're trying to roll it out throughout the organization, because they can bring their teams on board because they're fully behind the project. So that was a really key starting point for us. And then the next step would be to go and seek formal approval to go ahead with the project. And for this, we've talked about defining the benefits, but we also need to really clearly define the costs of this project. And they can be financial and non-financial, and it could be the one-off costs of implementing, but also the recurring costs of having this technology solution in place. So we just tend to do that in an Excel spreadsheet or, and then present the findings in PowerPoint or something. So it's quite simple analysis, but it gives the people who are going to approve the project confidence that they know what the costs and the benefits are going to be. And then if we've got the project sponsors on board as well, that just makes this process go through quite smoothly generally. The next point is identifying the project team and developing the implementation plan. This is often quite a challenge for us. When we're identifying our project team, we're identifying all the people in the organization that we want to be involved. And this could be tricky because often we don't have, I'm sure like many of you, particularly during COVID times now, we don't have people who are just sat around with spare time to invest in these projects. So we have to manage that. We have to think about, well, can we reallocate some of their responsibilities? Can other staff do extra hours to help them? But sometimes we have to recognize that maybe we don't have the resource in-house to do it, and we're going to have to rely on external resources. Maybe we're going to have to recognize that we can't do the project in 3 months and it's going to take 6 or 8 months, and we have to accept that and build it into the project plan. The next two steps often go hand in hand, but communication is critical. We want to, at the very beginning, when we're going to launch the project at a high level, we communicate to all staff. We want to tell them what the project's about, what issues it's going to address, what the benefits will be, and how it's going to impact them. As the project's then developing, we have more specific communication with the groups of people who are going to be impacted. And the reason that we do this is that we want everybody to be aware that this project's happening, for everybody to get a chance to get used to it, for them to raise their concerns or issues and give feedback and input that we can, adopt and build on. And we don't want them to feel like when the project's implemented that something that's just happened to them. We want them to feel as though they've been part of the process. And then finally, on this step, training. This is just really essential to the success of any project, I feel. We'll organise training sessions for all staff impacted. The training will generally be tailored to the specific groups. So for our sonography staff, our practice managers, We aim to have them face-to-face and hands-on, although that's not always possible. But we recognise that people learn differently as well. So there'll often be training documents, cheat sheets, question and answers. Those documents will be loaded onto a central platform like Practice Hub. The advantage of that is that, where we have casual staff who don't work with us very often, maybe, at least we know that they can go into Practice Hub, they can see the training information, they can sign off that they've read it, and we know that everybody has had consistent information. And as we get nearer and when we go live, we'll have an expert user at site so that if there are any problems, once the project's been implemented, there's an expert user at site that can help our team. They'll also will clearly say, this is the escalation path. If you can't help resolve a problem with this technology, then you either escalate it to somebody else in the organization or straight to our vendor, but this will be the escalation path for you. And that way our staff have confidence that they can make the solution work. And even if there are problems, they know who they need to go to get help. And then finally, once the project's been up and running for a couple of months, we'll circle back and review how it's doing. So is it generating the benefits and the costs that we were expecting? If not, why not? Can we tweak it? Can we get those benefits that we were expecting? And we know that we're going to be implementing more technology solutions as time goes by. So we want to make sure that we're learning our lessons. What did we do well? What did we not do so well? And how can we take those learnings and make the next project run even more smoothly?
Joe, thank you very, very much for those very helpful tips at operational level of implementing new digital technologies. One of the things I took away from your presentation is something that I've always done, is that's follow the paper trail. I'm a great believer, follow the paper trail. And that's based around the concept called lean thinking. And I think if we follow the paper trail of a piece of paper around the place, either it's just down to Medicare assignment forms or that GPMP form that goes around the place, or information backwards and forwards between doctors and treatment room. Follow the paper. And I think once we start to do that, we can see how we are challenged against, we may start to look at technology. So our takeaway messages today for me is keep up to date with new technologies to enhance your practice efficiencies. That may sound easier, harder than what I've got on the screen, but you need to be mindful of what's happening in your discipline. Start to think about it and doing your environmental scans. Network, talk. I think one of the important things of also technologies carried a SWOT analysis. What are the risks? What are the benefits based around any technological introduction? I think pilot the process is really important. Small bite-sized pieces to see how it will work. And of course, the big one is manage change. And I think Joe's comment about getting the feedback in right up front, managing the communication process, the change process with relation to training to the end result, and re-evaluation is critical to success. So they're takeaway messages for today from our presentation. So I'll hand over now to Anna Maria.
Terrific, thanks Gary. Just while I'm logging back into our Practice Hub site, we do have a question around, are there external third parties that are able to review practice setup and advise on changes? I wondered if either of you had any thoughts on that in terms of where are good sources of information?
In terms of, we often get a lot of, as I say, we look internally and ask our staff and get feedback that way. We haven't actually relied on anybody externally to come in and review our processes and give us feedback. I don't know if that's something that you're familiar with, Gary?
Yes, strange enough, I've done it for about 25 years, I suppose. And I think there are people out there that have a very good understanding of healthcare space that can provide those services too. And dare I say, at the end of the day, they're not expensive in the scheme of things, but when you're looking for someone in the marketplace, they have to be specific to your industry so they can understand the nuances and the way in which your particular healthcare craft actually operates. So over to you, Anna Maria.
Lovely, thank you both. So in the time we've got left, what I would like to focus on is Gary talked about, and both Joe and Gary talked about the benefits of digital health innovation. And there are a few things on the slides that we looked at, and I thought I would tie those points back to different parts of Practice Hub. And the first one was around real-time data. And I think one of the important things is that, with things like the dashboard in Practice Hub, you can clearly see at any point in time things that you as this particular user need to be actioning. And if you're the administrator, the manager, you can also see what your team need to be doing as well. So the dashboard is a great control center to help prioritize what activities you need to be able to do. The other thing that we talked about was automated processes. So a good example of that was around compliance. So if you've got policies and procedures that you need your team to sign off on, it's really important to be able to do that in an easy way so that they're signing off when they're new users or the policy is new, or when, for example, you update the policy. So within a platform like Practice Hub, one of the things you can do is you can highlight a policy that needs to be signed off, and just quickly do a change so we can bring up our compliance. And so if a policy needs to be signed off, the users, according to their roles, will see a copy of the policy with the red banner on the top and bottom. So they're required to read this. They sign off that they've read, understood, and agree to comply. And when they click confirm, you as the manager now have an audit trail of when that person signed off on that particular policy. If you update the policy, you notify them, they go in, they sign off. So at any point in time, you know who has signed off on your policies, or more importantly, who hasn't. So the days of handing out 20 copies of a policy and then counting back who's given them back, who's missing, chasing up the missing, this is a much simpler process. So automating makes that a lot easier. Another area where I think it's really useful that you can automate is through the tasks function. Now, I know a lot of things, even Gary mentioned he uses tasks in Outlook a lot to keep his life on track, but this is really valuable, I think, for keeping your practice tasks, particularly those things that are sort of frequently recurring tasks that you want to be able to ensure that people are keeping on top of them. And, you know, we've got a list of task templates here, and they really, I think, just give you an idea. If you start to think about all the things that you do need to be on top of, you and your team, having these sorts of tasks all ready to go and assigned to the right people makes life a lot easier. So you can add things like checklist steps, and this is fantastic for new people so that when they go through, they actually will see step by step what's required to complete this particular task. You can select who needs to complete it, and you can make that a recurring task so that these things are done in a way that I guess reinforces what I think of as operational excellence as well. The other thing that I think it's really good to automate, and Joe, I suspect in your practice you have a phenomenal amount of equipment that requires maintenance and is no doubt very expensive, but having things like an equipment register where you can keep all this information in one place, and that this can act as a sort of maintenance scheduler where you keep the dates where things are due to be maintained, certification, calibration, etc. You can use it as an asset register, so incorporating all the information in one place, and then linking any documentation that is relevant to that particular item in the equipment register as well. And that obviously is going to save you time when it goes to looking for that information, but also the ability to set those maintenance dates so you get those reminders consistently before the due date means that you can kind of organise and be proactive about planning ahead as well. A couple of things I think are really worth highlighting when it comes to automation, reducing risk and probably saving time, is the APRA Alerts application. So I know in a lot of organisations, you're either going online to the APRA site and checking, you know, is this person re-registered at the certain times of the year? Do I need to go and find that certificate from them? This application allows you to put all the APRA registered healthcare professionals, so doctors, nurses, allied health, into the system with their APRA numbers, and it automatically flags if there's any change in their registration, if they've forgotten to renew their registration, all those sorts of things that can kind of give you peace of mind by automating that process as well. I know one of the things that both Gary and Joe talked about was communication. And I do feel sometimes that when it comes to policies and procedures, the management team seem to become the burden of being the, you know, having to make these perfect and up to date and everything. But one of the things that you can do, and again, from the point of view of automating and being collaborative, so one of those benefits was that collaborative sharing, is that ability to sort of circulate a policy and say, okay, could I have your feedback on a policy? You know, I'm thinking of updating the dress code. I want to add in that the clothing needs to be, you know, it needs to be a certain colour. I can ask other members of the team, what do you think, before I actually go ahead and publish that policy. And similarly, the members of your team can also send you their contributions. So if they've been reading a policy and they want to quickly let you know that they've seen something, they can go through and do that. And they can simply add that. As the manager, you get to see that. So we're doing away with post-it notes, emails, must remember to tell you next time I see you, all of this kind of thing. So very simply, you've seen your contribution, you can provide feedback, you can make a call on whether you're going to refuse it, implement it in the future, or you've perhaps already implemented it. So again, that collaborative approach is really important. One of the other things that was mentioned was that supported decision making. Now, I know often that's thought of in a clinical sense, but I do think that when you've got good policies and procedures, it makes it much easier to integrate new systems and processes into that as well. I think if you have a sort of a framework, you can then build around that for when you're introducing new things. And of course, the other thing is with your new technologies, and I'm sure, Joe, you've thought this through, is what's the impact on other aspects of the business of bringing in some of that new technology? How does it impact on things like, the code of conduct, on privacy, on acceptable use of those items of that technology? When it comes to clinical things, scope of practice. And I think, Gary, on one of your slides in the top 10, you had point of care testing. And, there'll be point of care testing standards that you need to meet. So you'll need to have policies and procedures to support those as well. I guess just lastly, when it comes to one of the key items that was on there, improved patient outcomes, I think having good systems like this, if they're clearly documented, they're easily accessible, that will lead then to consistent high quality processes for how you manage your patients, because you'll have that consistency across the board. All right. So that was a super quick look at a couple of components of the Practice Hub platform. But just to wrap up, if you are a Practice Hub client and you want any more information, please contact our lovely support team who would be delighted to help you. If you're not a Practice Hub client, visit our website to find out more and have a chat with our sales team who can give you a much bigger demonstration than the one I've done. The recordings of all our previous webinars are also on our website, and I know there's been some really popular ones as well. Without putting Joe and Gary on the spot too much, any final words from either of you?
My only final word, Anna Maria, is really is to do internal analysis is the first bit of what you do need, and then be mindful about your environmental scan. What is in the marketplace and what's going to suit what I'm looking for. But just follow the piece of paper trail. I think that's a great indicator to start about technological solutions.
And from me, I'd say just remember the importance of communication, and training.
Fantastic. Can I thank Gary and Joe? Thank you so much for your insights and your participation today. I think it's been really, really useful. And thank you to all the people who have watched our webinar today. Thank you very much, and we'll see you next time.